So Health 34 got a call from a student last year that was really distressed, identifying that they needed help, but they couldn't really identify much more than that. And the help was pretty clearly like mental health sort of help. We made contact with the student and they expressed immediately a huge amount of stress from their family, that they didn't have support going to university in the first place. That was like not something the family really approved of, that they wanted to go to higher education. And another part of that is that the family's like deeply distrustful of mental health care and healthcare in general. And they had come here, experienced, the stress of being at school, and something wasn't right for them. And at that time, we kind of identified that the emergency room would be a pretty good place for them to go be assessed. They didn't have any diagnosis. They didn't have any broader understanding of what was going on. And they had really profound fears of the billing situation and using their insurance and what it would look like when the family found out. And so we were able to get them the care, help them communicate to the billing people what the situation was, and connect them with the Health Equity Fund in order to try to get some care that was appropriate for them without their family withdrawing the small amount of support that they had. And in that, we did what Health 34 foundationally is hoping to do, which is create a relationship with people in which they trust us in a uniform that maybe isn't otherwise very trustworthy to some groups. And since then, they've called us for all sorts of stuff. They've had interpersonal relationship issues while at school that they just lack the support or upbringing to kind of navigate on their own. They have therapy now that they have a good ongoing relationship with. They have access to psychiatry that they didn't have before, and are getting an education that they certainly would not have been able to get without some sort of outreach from a party that could actually support them and connect them.
Welcome to EM Pulse, bringing research and expert opinion to the bedside.
We're your hosts, Julia Magaña
and Sarah Medeiros.
Welcome back to EM Pulse.
It is always so interesting to see how medicine evolves. And lately, I've noticed a local trend toward moving out of the hospital and into the community to get resources to people where they are.
It's not something that I think about too often as someone who very happily and exclusively works in the hospital. But to be honest, I often find myself thinking, if only you had been seen sooner, or you really didn't need to call 911 and you really don't need to be in the emergency department for this particular issue. If only.
Yeah, exactly. And the cool thing is there are people here at UC Davis right now who are experimenting with addressing these very questions. So we're going to do a multi-part series on bringing medicine to our patients, or medicine on the go.
Today, we start in the pre-hospital world with Health 34. Health 34 is a UC Davis Fire Department no-cost mobile mental health crisis unit. Okay, try saying that 5 times fast. It's on the university campus of UC Davis.
And Blythe Clark is a Health 34 provider. So welcome, Blythe.
All right, Blythe, let's start at the beginning. What exactly is Health 34?
So Health 34 is a unit on campus in Davis that is available 24 hours a day, 7 days a week to support our community overall. We aren't exclusive to students or staff. Our aim is to help any person on the UC Davis campus. Obviously, there's different resources for different groups. And like you might guess, we largely support students, but we answer the phone in person and connect people to resources or provide just someone to talk to.
So where did this come from? Why was Health 34 created?
Health 34 was created in 2021 by the Campus Safety Oversight Committee. It was created with the aim to prevent crisis whenever possible. And there's a lot that went into this being like dreamed up, but it was an acknowledgement that we could do better at supporting our community than only offering a 911 call with either a fire department and a paramedic or a police officer.
So how does this actually work? Like, how do students know to call you, or do they call you? How does that work?
Yeah, so most of our contacts are from students requesting help for themselves. They contact us by calling a 7-digit phone number, which gives us a separation from the 911 system, which is an important piece of like acknowledging that you aren't having an emergency or needing an ambulance right now. And so they call us, we answer the phone, and then do an assessment of what's going on. Sometimes people are calling for something that's totally not appropriate for us, but we recognize that like basically any small ask, if it escalated, could turn into something bigger for them. So we really just try to connect them with the appropriate resources when it's maybe not the most appropriate to call us, but we're happy to, tell them, oh, you should call the police, or you should call 911, or you should go to student health and counseling. So it's a lot of like resource allocation.
Are there specific hours?
We work 24/7.
And who makes up the team?
Our team is 5 people. There's 4 providers in my position that provide 24-hour-a-day coverage. And then we have an assistant that works Monday through Friday, 9 to 5. And the remainder of the hours, we're staffed with one of the student EMTs that work for the fire department.
Do the members of your team have any specific like mental health training, or where are you guys coming from?
So we all are paramedics, but that mostly, other than your lived experience, lacks formal training in mental health. We went through a training program called the Lay Counselor Academy, in which we learned a ton about just good communication. And then we've done hours and hours and hours of trauma-informed care training, and had a week over the summer that we did like 40 hours of additional training. So although it's not like a formal single program, we've received a ton of information about mental health care.
And when you show up, does fire show up also? Does another medic crew show up too, or just you guys?
Just us. We are trying to give people as much ownership over their care as possible to build trust in communities that might be apprehensive about getting mental health care or other forms of health care. And so as long as it's safe, we show up, just like the provider and whoever we're working with. And then we will call 911 if that's necessary, but it's usually just us.
So, Blythe, give us the pitch that you would give students. Like, when's the ideal time for UC Davis campus people to call the 7-digit number instead of 911? When do you guys want to be called?
We want students to call us when they need help. We want them to call us when they're feeling uncertain, when they're noticing that maybe they're becoming like increasingly overwhelmed, that they were doing really well academically in high school, and now they're like unable to get their assignments in on time, or their test scores aren't what they think they should be, or their relationship with their parents isn't what they wanted it to be, or they can't really get out of their dorm because they're overwhelmed by the entire experience. Because like you said in the beginning, like so many things that happen once they're in the emergency room, there was a huge window of time before that. There's a huge window of time before like a college student is suffering from like severe anorexia or being suicidal or whatever draws them to the emergency room. Like there's tons of symptoms before that. So we really want, even if it seems minor and they don't know that there's help, we want them to call so we can like connect them to resources, and mostly just tell them that what they're experiencing is really hard and they aren't the only ones going through it.
So someone calls you, and how do you actually show up? Are you in an ambulance? I'm assuming no lights and sirens.
Yeah, no lights and sirens. We are in like a van that's like very visible and like branded with Health 34. But unlike an emergency response where a bunch of people that are uniformed like walk into your house and take you out on a gurney, and maybe it feels, even if it is your choice, it might feel like you have a little less ownership over it. Our van is wheelchair accessible. You walk in on your own. You sit on a bench or sit on any of the seats that we have on your own. The windows are all super tinted, so it's a super private place that we can talk. A lot of like the people we come in contact with, you know, they are in a group living situation in the dorms, or they have a ton of roommates. So being able to move the van around and have like a private place to have a conversation is really nice. And then we have like blankets and fidget toys and snacks, and just try and make it feel like a place that someone feels like comfortable and cared about.
And what services do you offer them when you connect with them?
So we offer a connection to other campus resources mostly. We partner with OSSJA, which is the Office of Judicial Support and Student Affairs, and their case managers, who are able to kind of like reach out and to bridge the gap often between like either a mental health medical need and then also the like academic side, because these are two pretty opposed groups. Then, you know, we are mandated reporters and, you know, try and be very forthcoming about that with people. But we connect people who don't want to talk to a mandated reporter with CARE, which is another organization on campus. Compass is a basic resource organization that we use a lot when people are having a hard time with housing. People often like don't know that there's options for housing once they've been put in a dorm with their quote unquote nightmare roommate and they like can't do school, they can't sleep, they can't, you know, all these things. So those are all like kind of gaps that we're filling and connecting people to.
So Blythe, this is such a cool program. Where does funding for a program like this actually come from?
So I'm not positive about the specifics of this, but it's funded by the campus. You know, we aren't receiving money from the state or another government.
And how is this whole program working out? Like, what does success look like to you guys?
That's a really good question. We're very new. We launched in September of 2023. And the measure of success in a program that's aimed at a lot of prevention, like preventing people from crisis or preventing people from ER admissions, it's just a really, really hard number to measure.
Yeah.
But I feel like people who contact us are a success. We have just over 1,800 calls to us since we launched. And I think that that is our success, is that like we were able to like advertise ourselves in a way that people felt comfortable calling us with something that's usually a pretty like personal problem.
It's a lot of trust. 1,800 trust points. Mm-hmm. That's impressive.
So as emergency physicians, we often see patients after a crisis has already developed. How can programs like Health 34 change that dynamic?
I mean, I think that all of these programs, like us, the mobile crisis units, all can assist in getting better resources to people earlier. Having worked on an ambulance, and you guys having worked in the ED, like we know that mental health care is not best provided in an emergency room.
Yes. At least the big stuff, the longitudinal piece of it.
Yeah. And so if you think about how you can prevent that other than just saying like, you're not welcome here, which is obviously not a good solution. The other solution is to say like, how do we get to you sooner? And that's an interesting piece, thinking about like these college students. And I don't know how it would be measured, but the people that you see on the streets or with profound mental illness, substance use disorder, that have very few resources, they were once teenagers. And it's hard not to ask yourself, if they had had support then, would they not be in this position now?
Yeah, I love that thought, Blythe. And I think about that, working in the pediatric emergency department, we see kids entering those moments. And, this is just kind of like an internal thing that I think is, I don't say this out loud to them, but I'm like, okay, what can I do to help keep you out from under the bridge, right? Like, what is it that you need from me today to get onto that successful pathway? And sometimes I feel very under-resourced myself in the emergency department, but I love that other people are thinking about that. That should be all of our goals.
Yeah. Yeah, absolutely. And it's just like all of this, like diabetes. If you could manage that with a healthy diet and access to healthy food and knowledge about what healthy food is when you're young, if we would treat mental health the same way and have people ready to help and offer resources and not try and make people act their way out of a big mental health problem, we would be in a better spot.
Do you think that this model could work outside of a college campus, for example, like in Sacramento, in an urban or even a rural community?
I think it has potential to work. I think that funding, we are completely free to the community we serve. We serve a very insured population and a population with a fair amount of resources available to them. But talking about reasons that it couldn't work feels like an excuse that will result in more of the same. So I think it has potential. I think that looking at the community needs and the funding of like existing community resources is essential if it wants to survive like outside of what we're doing.
Yeah, and I'm really hoping that our discussion today is going to inspire some people out there to try to develop similar programs in their area. What advice would you give to other departments or other organizations that are considering launching something similar?
So this might sound like a pitch for my profession, having been a paramedic for a long time, but I think you have to hire problem solvers. I think there's so many jobs that exist in a bubble of either only being willing to work certain hours or only being willing to work in certain environments. Paramedics like are used to being like out in the wild and having very few resources and being like, okay, saying like, I don't know this right now, but I can do my best to come up with an answer for you. Health 34, the 4 providers are all experienced paramedics. And it's interesting to hear us, because we all have a knowledge of the pitfalls of what happens when people don't have resources.
Blythe, where do you see the future of mobile crisis units like this going in the next 5 years?
I mean, my hope is that they do nothing but increase, but that's hard to imagine with the cuts to Medicare that are happening. Other than us, most mobile crisis units are funded by Medicare. So we'll see. In California, I'd love to see community paramedicine become a widespread possibility, but there's,
financial barriers.
Yeah, financial and political barriers.
Yes.
But I think it has a great potential to reduce the already busy ERs and get people better care that's less traumatizing to them in a lot of cases.
Yeah, absolutely. Well, thank you, Blythe, for sharing with us.
And this podcast was pitched by our colleague, Dr. Lisa Mills, the UC Davis Fire Department Medical Director. Thank you to her and our department for innovative ideas like this.
And thank you to OM Productions for innovative podcast production ideas.
Keep listening as we check out other innovative ways medicine is breaking out of the hospital.
So until next time, stay curious, stay inspired, and stay tuned.
The opinions expressed on this podcast are those of the hosts or guests and do not necessarily reflect the views of UC Davis Department of Emergency Medicine, UC Davis Health, or their parent organizations.